Hello, welcome to What's Up with Jessup. This is Mitchell Blatt joining us all the way from China. This is the wee hours in the morning. He is a contributor to the National Interest, author of two guidebooks, and he writes the ChinaTravelWriter.com. Please make sure to check him out there. He's also been featured in outlets like the Daily Beast and Korea Times. Hello, Mitchell.
All right, thanks for having me.
Thank you. So we are here to talk about the coronavirus happening in China. I understand you're in China. How is the situation there?
I just recently arrived in China just in time for Spring Festival. Didn't know there was going to be a virus too. And I've been, one reason is to come also is I started recording YouTube videos. You can find me on about China, introducing people to China, called Mitchell Blatt, China Travel Vlogger on YouTube. Now, it is pretty intense. It's been spreading across the whole country. There's close to 3,000 cases now. But well, it's different in different provinces, and I happen to be in eastern China, in Nanjing, about 500 miles away from Wuhan, and there's not as many cases here. But still, everyone's taking precautions. You have to wear a mask if you leave your place. Lots of people curtailed their Spring Festival celebrations.
Wow. So how bad is this virus? What happens when you contract it first? Why is it such a scare globally right now?
Well, it's affected close to 300 people, and over 60 people have died. Basically, it brings on a very bad form of pneumonia. Now, I don't know like any of the biological details.
Sure.
It has appeared to be spreading pretty quickly, and that is aided by the fact that during Spring Festival, most people return to their hometowns. So there's been so much people traveling on train, on plane, and everything that it makes it easier to spread. And it can stay dormant without without showing symptoms for like a week or two. And so many people don't know they have it at the time. Then 1 week later, they find that they rode in a train with someone who had it.
So a lot of travel instigates this spread of disease, and usually it's really even hard to know that you have already contracted this virus. That's fascinating. And so, having lived there for a little bit, do you see any difference in how people are reacting to the virus in China?
Well, I don't know how. I mean, I don't know if in my memory or my experience there has been any kind of outbreak like this in America. So I don't really have anything to compare it to. But I do say everybody is on high alert. The government has been on high alert. The central government has been on high alert ever since it became widely reported, although the local government in Wuhan did not do such a good job containing it at the beginning. They tried to respond on their own and outright failed. They kind of covered up some of the local news when it first came out. Let me give you some examples of what the government at both the national level and different local levels throughout the country are doing. So first, about a dozen cities within Hubei province, including Wuhan, have been quarantined. No more transportation in or out of Wuhan. Some cities in other provinces have like self-quarantined, preventing any transportation from coming in, such as Shantou City in southern Guangzhou. A lot of cities are preventing anyone from Hubei from coming in. That's where the virus started. That's where Wuhan is located. And there's been high-speed rail suspended in Guiyang The currently being Spring Festival, every school is on break, but most schools at the university and high school level are pushing back their start date for the next semester by at least a week.
That's fascinating. So all kinds of travel has been blocked. Some kind of quarantine has been done. That's very interesting. Because I look at North Korea, we've seen that at least in North Korea, they've, I guess, banned travelers or tourists from China from coming into North Korea, obviously, because the health infrastructure is not great. And so the influx of such a virus could be deadly for the country. And even the United States, the CDC, I heard, has been trying to provide a virus and I guess test measures that are more effective in, I guess, seeing whether these travelers from China have contracted this virus in an effort to, you know, prevent this from coming into the United States. So it's definitely a global issue. I was interested about, I guess, Wuhan's uh, how Wuhan first reacted independently. What is the mistake there?
Well, just for example, like they were trying to uh, cover it up and solve it on their own before it became an issue. But one example is a lot of the measures they did were counterintuitive. For example, they said that they stated a goal of zero transmissions within the hospital. Now, of course, they tried to meet that goal by lying. So there was like 14 doctors and healthcare professionals who got the disease, but when it first came out that they got the disease, they covered it up, and then only later did they have to admit the severity of it.
Oh. And why do you think the reason for that was? Was it because politics? Because the superior officer will look at you in a different manner?
Well, of course, both Wuhan local officials do not want to be associated with this disease, and also on the think with a viewpoint towards the national level, they don't really want it to interfere with um, to become a national issue and potentially interfere with Spring Festival. However, now that it has become a much bigger problem than it would have been, Wuhan officials are in an even worse position. I mean, Wuhan's mayor was asked by CCTV, "How will you grade yourself?" And said, "I would give myself an 80 out of 100." And he was roundly mocked by local people. And also, Hubei's mayor, Hubei's provincial governor, at a press conference, was trying to say how many face masks Hubei province produces, and he made mistakes multiple times. He said first 100 billion, and he said I made a mistake. I meant 10.8 billion, and then he's like, "Uh-oh, that was a mistake too. What I meant was 100 million, something like that."
Ah, I see. That's a huge difference in the number of masks that are distributed.
So basically, like, not only did they do a terrible job in the first place, and now they're still doing a poor job, at least at the very least, in media relations.
Ah, media relations. So at least in the case of North Korea, the North Korean state said, according to the UPI, that the Chinese government is taking relevant measures, quote unquote, and therefore was praising the Chinese government's procedures and measures taken. What do you see going on in terms of media?
Ever since it became known on the national level, now they have been stepping up their measures, and the national government has been taking strong measures, as well as many local governments outside of Wuhan as well. And Xi Jinping is definitely making a big effort to show they're taking measures. And the news that they are reporting is becoming much more transparent. They're putting much more news out every day because they don't want to be accused of downplaying it. Um, Now, as to how effective it's going to be, again, I'm not any kind of healthcare professional, so I don't know by what standard. I don't know how it's working out, but um, but it does inspire confidence in people that they're taking it more seriously.
I see. And so it was a disaster media relations wise at the beginning, but starting when there is national, I guess, exposure, the Chinese government is taking good measures, I guess.
Well, yes, I think you also have to make a distinction between the local government and the national government, and oftentimes it's not such a centralized state. The local governments often uh, act somewhat independently until before then the national government has to respond, in some cases respond to their mistakes. It's hard to govern this many provinces, and sometimes the mountains are high and the emperor is far away.
Right, right. The figurative emperor, I imagine you must be meaning. Very interesting. So the independence of these, I guess, different cities and provinces can be a strength in government, but it can also be a danger. How do you think we can best prepare against these virus outbreaks in the future for China?
Again, I'm no healthcare professional, but just from the response this time, I mean, in contrast to SARS, the national government seems to be doing a better job, but they need to make sure that every local official knows that there's that you need to take these things seriously and report honestly from the start. And make sure that if they do report honestly, no one's going to be punished for it, and that anybody who did cover it up in contrast is going to be harshly punished.
That makes sense. So the incentives that government officials have really shapes how they report. And I guess we've seen this before, in the past, China Great Leap Forward and things like that. There's a tendency to maybe exaggerate goods and try to underestimate or not show any bad things happening.
Yes, oh, to a lesser degree now, or in a lesser degree of severity now, you see local officials exaggerating their GDP numbers.
Mm, fascinating, fascinating. And so I'm just imagining, I guess, as a local government official, when you see someone who is sick, how do you even know? I would imagine it would be a pretty hard job because the coronavirus, the symptoms are very similar to maybe like what you would see in a cold. It's easy to confuse it. Do you see this as I mean, you've already touched on this, but as a honest mistake, or they already knew that this was a bad virus outbreak?
So by December of last year, there were reports in among the people in Wuhan and among some of the local media of a mysterious virus that was much more severe. So they knew it was happening, and the officials were
Mhm.
actually trying to. Uh, they knew what was happening in the hospitals. They just didn't admit to the severity.
Really? Okay, that's very fascinating. I thought this was just happening just the past week or 2 weeks, but you're saying that this has happened even since December.
Yeah, in fact, one expert found that the first cases, now they might not have known in November, but the first cases probably started in November, and by December, people in Wuhan were talking about it.
Oh, okay. That provides a much better picture of how the outbreak started and how maybe the government officials would have responded to that. That's interesting. So, living in China, I guess, is there anything else that you found interesting about this outbreak? Um, are you scared personally?
Just you mentioned a compare. I'm not too scared. It if you look at the numbers, they're huge numbers, and it's very concerning. But if you look at the size of China's population too,
Hmm.
any numbers coming out of China are going to be huge when you have a population that's 1.7 billion.
Mm,
Now,
that's a
I'm thinking, yeah, I'm thinking back about something else you said about what would happen if a virus of this scale happened in America.
mm,
Now, for one thing, it also, like you said when you mentioned North Korea, it also depends on how good your healthcare infrastructure and everything is. So there actually are a lot of viruses that could in America that could be a lot worse if we had a worse healthcare infrastructure. That's part of it.
mm.
But if there really was something where we needed to have quarantines and we needed to like force everyone to wear masks, I mean, it might play out differently. It might be difficult to muster the response needed in where a country with a distrust of the government and with a lot of conspiracy blogs and everything. I don't know how it would play out. There might be some people like opposing a quarantine or other kinds of measures that have been taken.
Ah, and you're talking about the United States, not China, where
Oh
there are.
yeah, just not in China. I mean, there's some skepticism. There's people who think it might be bigger than it really is, and there's some people talking on WeChat, the local messaging app. But at the end of the day, the government has the power and the support of the majority of the citizens.
That's fascinating. I actually imagined the exact opposite. Yes, there are conspiracy thinkers in the United States, but I imagined that the distrust in China would be larger, and therefore people would be less willing to comply.
I mean, people in China are pretty, just from an empirical standpoint, regardless of normative judgments, people in China are quite supportive of their government. If you go back 30 years and look at how much they've developed the economy, and under Xi Jinping, he's talking about reforming the economy to escape the middle income trap. He's talking about alleviating poverty, and he is talking about cracking down on corruption.
Hmm.
Now, regard whether or not these measures ultimately work, that's one thing. But for the time being, the public sees what they are doing and is optimistic.
That's fascinating. And do you remember any previous outbreaks where the Chinese government has responded to this and the people have been very receptive to mass, I guess, responses?
Uh, Actually, there has, and I've talked to some Chinese people who were here in 2013 during SARS, and I was here in 2003, I should say. In 2003, there was SARS, and in 2013, I was here when there was a relatively less severe outbreak of bird flu. But even people who were here in 2003, they say there was nothing like this. There were no quarantines in 2003. So it's uh, the most intense response of anybody can remember in the past 2 decades.
I see. So these kind of sorts of quarantines, they've never really been done before, so we wouldn't really know how receptive people are to these kind of measures.
I don't know how receptive they would have been in the past. Now, in
Mm,
the present, most people, I mean, if you talk to people outside of Wuhan, uh, everybody is happy to not have such a possibility of it spreading. Within Wuhan, it's difficult to purchase food and everything. People are thinking about the future and thinking about how long it's going to last.
mhm.
But I haven't talked to too many people from within Wuhan, so I can't be sure what they think.
That makes sense. Right. So let's talk about like the health, I guess, systems in China. Do you think it's adequate? Are there enough vaccines? Are there enough masks that can
Uh,
be introduced quickly?
Actually, there has been many calls by local hospitals. There's been many releases saying we are lacking masks, we are lacking other kinds of things. And there's been a lot of masks donated from abroad, including from Japan, and the United States.
Mm,
And in fact, I was thinking about looking at some of these releases and translating some into English to share with my audience on chinatravelwriter.com/blog.
yes.
Yes, if anyone in America wants to help, there's certain products that hospitals are actually asking to be donated.
Right. So this is an example of international aid coming to the rescue when health infrastructure may be lacking in China. That's fascinating. And so, have you heard anything about people in Wuhan? You've talked about people not having enough supplies and things like that.
The fear and is that some of this that it will be harder to get food into supermarkets, and that the price of food might increase. So I don't know, what the logistics are of that, but it seems like it might be harder. But certainly there should be people trying to solve that. But I can't comment at any with any expertise.
I see. That makes sense. And there has been news about building massive, I guess, refugee camps almost. We've seen just cranes and cranes just in fields creating and constructing a massive refugee camp for people who are contracted or people who have to be
Well,
quarantined.
I haven't seen the refugee camp, but they're trying to build a hospital in 1 week's time with 1,000 beds.
Exactly, must have been a hospital. So this is, I guess, a scale that we don't really usually imagine, where something happens and then you just decide to build hospitals right away. Probably only possible in China and a unique phenomenon. What do you think?
Apparently, in 2003, during SARS, they also quickly built a facility. But
Right.
yes, China can get things done quickly.
Exactly. It's just marvelous. I guess the amount of construction infrastructure and like possibilities, capabilities they have is very, I guess, adequate, but just the health care and the health infrastructure is not.
Another thing in Wuhan is that hotels have offered up their rooms to anyone, to healthcare workers and anybody who needs to be close to the hospital.
Hmm. Interesting. That could be a good gesture, but also maybe a disease vector, maybe where the virus may spread.
Yes, well, ultimately, you need people in the you need people who work at the hospital to live nearby. And one of the things is that public transportation has been shut down too in a number of cities, so they can't get there by bus.
Right, right. Also, we've heard a lot of doctors, nurses, people, health professionals who worked on these virus patients contracting the disease themselves. What is happening there?
Well, like I said early on, about 14 uh, healthcare professionals contacted the disease in Wuhan, and clearly, I suppose the risk still exists. But I think also they would probably be taking more precautions now than they might have at the start.
Right, right. So I guess do you think there is a system or like a procedure, standard procedure that allows these health professionals just a mistake? What do you see this as?
Uh, I don't know. if you if you see pictures now, they're definitely wearing a lot of. They're definitely wearing heavy suits.
Right, right. Because it's a really tragic story where a doctor who's trying to save lives dies himself trying to save these lives, and having procedures in there so that these healthcare professionals don't get contaminated or infected would be important.
Yes.
This was very interesting. Thank you so much for telling us about so many things that's happening in China. I learned so much about the coronavirus. Did you have anything else to add?
Uh, no, I just want to say everybody in China, everybody wherever you are, but especially in China, Just stay safe, take precautions. But I think we can get through this, and I think, you know, most people are we're going to get through this, but we need to continue to be sending our support.
I completely agree. Make sure to check Mitchell out at ChinaTravelWriter.com. You can also get this podcast at What's Up with Jessup on Spotify, Apple Podcast. Make sure to rate, comment, do anything, suggest it to your friends, enemies. And yes, thank you very much.
Yeah, thanks for having me.